is Kimo Kimura. Should assisted death be legal? Death is inevitable. Death may be prolonged and can come with a great deal of pain and suffering, both physically and emotionally. For those who are facing their mortality, the option of ending life on their own terms is controversial, and the question becomes, should assisted death be legal? For lawmakers, passing legislation to legalize assisted death presents obstacles, including under what circumstances assisted death should be allowed and what methods of termination should be approved. For clergy, the question of morality and sin plays a heavy role in the support or opposition. Physicians may have personal ethic issues or concerns of liability. However, many physicians feel that the medical association's ethical judgment focuses too much on the physicians and not enough on the patient. The general population will also debate for or against based on personal experiences or religious beliefs. The right to die on one's own terms should be a personal decision and not one of another. Whether one decides to take action on their own or is assisted by another willing party is a decision that should remain between one's soul and his or her beliefs, and we need to support their decision and encourage our lawmakers to pass legislation that allows the right to die. Death with dignity, the exigence of assisted suicide is a person's right to die on their own terms. Many who are suffering at this moment are without the option to transition with the aid of professional help without breaking the law. And if you are a person assisting, you may be facing a murder conviction for simply offering the same mercy you would give a beloved pet. I think most people hope to fall asleep and simply never wake up. The worst case scenario, we would choose to go quickly. But what if we were faced with a terminal illness? What if there was no treatment? Maybe you would run through a bucket list of all the things you wanted to do in your life before you no longer have the ability to do them. Now what? You wait day after day for your life to end, for the pain to end. Why should you or anyone else have to lie in agony? For anyone who wants to have control over the end of his or her own life, you need to consider supporting aid in dying. Remember, this is a choice. If you believe in a sin, it's a sin. You have the right to hang on to the bitter end. There are plenty of sources for the project that provide facts and that rationally support the passing of a law that permits aid in dying in all states and countries. Currently, there are 5 countries that have legalized aid in dying. The U.S. now has 6 states that allow assisted dying, with California passing the right to die legislation just 2 days ago. Senator Eggman was quoted as saying, "This issue is of immense importance to all Californians. All of the countries and states have established criteria in qualifying a person requested to die with aid. These predecessors offer a platform on which each country and state could use to build its own right to die laws. The criteria should include methods allowed such as palliative sedation and or medications that can be self-administered. Verification of the terminal illness might be confirmed by 2 independent physicians. Patients' consent might be approved after required counseling by a licensed psychologist or minister, so that the patient is given the opportunity to make the most informed decision before transitioning. Perhaps the most persuasive reason to legalize assisted death is the individual who has no other choice but to die. It's just a matter of dying at the hand of an illness or dying on their own terms." In the Frontline report, The Suicide Plan, Andrew Solomon, whose mother chose a lethal dose of Seconal over prolonged suffering of ovarian cancer, states, "I believe it was the right decision, right for her and for all of us. She valued control, and she valued coherence, and she died as she had lived, with elegance." In a CNN story, Brittany Maynard was just 29 years old and had been married for only a year when she was diagnosed with terminal brain cancer. Brittany and her husband were forced to move to Oregon and establish residency where assistance is allowed. When her suffering became too great, she was able to pass peacefully with friends and family by her side. For Brittany and many others, Legalizing a peacefully passing should be a right and not a violation of the law.